Hi, my name is Tonda Amerson. I'm 35 years old. I have 2 kids and I work full-time, which is 36 to 48 hours on night shift.
My name is Audrey Morales. I'm 25. I'm married. I work part-time.
I'm Dawn Simpson. I am 21, so I came right out of high school, into college, into the nursing program. So I currently still live at home and I have no job.
My name is Anwar Gonzalez. I'm 21. I'm not married and I work part-time.
I decided to go to nursing school at Jeff State because I pursued my career as an EMT here and I really enjoyed going to Jeff State, so I wanted to try to get into the nursing program.
I chose nursing because I like to help people and I like the disease processes and the human body, and I chose Jeff State because it has a great nursing program, so I've been told, and it's close to home.
What I wish somebody had told me coming into nursing school is how the testing will be. I'm a very logical thinker. Testing in nursing school is not knowledge-based at all. Now, first semester they will kind of bring you into it and kind of get you kind of used to it a little bit, but it's definitely the biggest thing is be prepared to do a lot of NCLEX style questions, a lot of critical analysis questions, because it is not like any other testing.
You really have to commit yourself to studying and learn test-taking skills just to figure out exactly what works for you. And another thing is like clinical experience-wise, it's your patient care. You have to really love being around patients and family members and learn how to get along with them.
Some study skills and study habits I would share with oncoming students would be get involved with a study group. Get to know people that have different thinking and can help you analyze questions differently.
Record the lectures if your instructor lets you. I would go back and listen to the lectures every night, take some notes that stand out to you. And second thing, I would recommend not to cram at the very last minute, because believe me, it does not work.
Set aside a time that you're more alert and you can focus on studying. Make sure you block out outside noises and just find a place that you can settle your mind before you start studying.
You can go on different websites and there are NCLEX style books. There are different success books for med-surg, for fundamentals, pharm, and fundamentals and pharmacology is actually what first semester will be for oncoming students. So I definitely recommend getting those. You can never have too many books.
The way that I take notes during lecture is I actually record the lecture because I'm better going back listening to my information.
And the reason why I record and take notes is because if I'm lost on a subject or if I don't get everything, or some days where you're just so exhausted you kind of tune out your teachers a little bit, I can go back to the recording and hear what they say when maybe I'm in a quiet environment, and I can take better notes, more detailed notes.
One way I managed my time effectively is by buying a large calendar and putting it somewhere where I would see it every day, writing down important dates, test dates, clinical dates, focus review tests when they're due, and as well as writing down my study times.
Nursing school is demanding. A tip that I would have for managing your time is take time to rest. Take time to have just a little bit of time for yourself, but also put in the hours of studying that is required.
Critical thinking in nursing school is very vital, and it's very important because when you go into a patient's room and they could have something as simple as, they just are dehydrated, so you're giving fluids. But that dehydration can go into so much more. Everybody responds differently to different types of fluid. Everybody's care is different. So nursing school really gives you different perspectives on how to look and think critically for your patients, because their life is in your hand. You have to take care of them, and if something goes wrong, that patient and their family relies on you to make sure that you know what you're doing. So I've learned in nursing school too that you're going to want to complain. You're going to want to say, oh, I don't know why we're doing these case studies. I don't know why we have to do all this work, or I don't know why we have to do all these skills every single semester. And I've always said I'd rather go to a school that makes me do those case studies and makes me do those skills. So when I go into a hospital setting, I'm not asking anybody how to do it. That my patient knows, okay, my nurse knows how to do these skills. She knows how to take care of me. She's seen this before. She's done stuff in school that helps her. So now, looking back on it, I would go back and say, don't complain, because it's going to help you in the long run.